Hello, everyone. Welcome to another episode of Psych Talk. Today, I will talk about dependent personality disorder. So, according to the DSM, this disorder includes difficulty making everyday decisions, avoids disagreements for fear of being rejected or losing support or approval, difficulty doing things on their own due to lack of self-confidence that they can do it, excessive need for assurance, needs others to be responsible for certain areas of their lives, urgently seeks a replacement when a relationship ends, and they are preoccupied with fears of being left to care for oneself. And while dependent behavior may be developmentally appropriate in children and adolescents, in adults, a persistent need to be cared for by others may suggest traits of personality disorder. And these traits might develop due to mental disorders like panic disorder, depression, or agoraphobia, medical conditions, or substance abuse. Also, histrionic personality disorders and borderline can share similar traits, but dependent personality disorder is diagnosed only when traits are persistent, meet all the criteria, and obviously cause serious impairment or distress. Dependent personality disorder traits must severely impact functioning, as seen when someone remains in an abusive relationship to avoid living alone. And those with this disorder may have a background of insecure attachment or chronic illness, and depression often co-occurs, especially when tied to loss or perceived abandonment. Both dependent personality disorder and depression share similarities like negative thinking, catastrophizing, hopelessness, victimization, low self-esteem, and indecisiveness. These individuals often need constant reassurance, struggle with decision making, and seek guidance from potentially harmful people. And factors influencing dependent personality disorder include temperament, parenting style, genetics, and culture. For instance, parenting that fosters feelings of helplessness can lead to increased dependency, depression, and anxiety. And research suggests that adults with secure attachments are less likely to exhibit DBT traits, whereas insecure attachment styles increase the risk of this disorder. And those with dependent personality disorder might form romantic attachments with their therapist, requiring therapists to set very clear boundaries and avoid obviously physical contact and reinforce the professional nature of the relationship. People with dependent personality disorder may seek therapy after a breakup or a suggestion from others, or often out of fear of losing a relationship or a job. And they're likely cooperative and compliant in sessions, viewing the therapist as like a magical helper. And therapists should encourage independence while avoiding the impression that changes are made merely to please them. And obviously, the goal is to foster self-reliance so that new skills can be applied outside therapy. Also, therapy termination should be gradual to ease any abandonment fears, with follow-up sessions recommended. Some therapies could be cognitive behavioral therapy, which aims to promote independence and social relationships and not based on dependency. Also, CBT helps challenge beliefs about personal ineffectiveness, fostering self-efficacy and empowering clients to explore self-interest and autonomy. And also, schema therapy can address core beliefs, shifting approval-seeking behavior toward autonomy. The prognosis for DBT is relatively positive since individuals can build trusting relationships and also make commitment and ask for help. And so these traits contribute to a better treatment outcome than for many other personality disorders. And that is the end of this episode. Thank you for listening.